Welcome. Good morning, everyone, to our AIM coaching call number 30 today on March 25th. Next slide. Okay. So a call for acknowledgement and honor. Acknowledgement is a simple, powerful way of showing respect. It is a step towards correcting the stories and practices that erase Indigenous peoples' history and culture. It is a move towards inviting and honoring the truth. Truth and acknowledgement are critical to building mutual respect and connections across all barriers of heritage and difference. We begin this effort by acknowledging what has been buried by honoring the truth. Acknowledgement and honor. Every community owes its existence and vitality to generations from around the world who contribute to their hopes, dreams, and energy to make the history that led to this moment. Let's take a moment to acknowledge the ancestral homeland of the tribes in Arizona. Today, I am speaking to you from Phoenix and would like to recognize the O'odham and Peepash people who have stewarded this land since time immemorial. We pay respect to their elders, past and present. We are grateful and appreciative to those whose territories reside and work here today. And then we'll have a little disclaimer slide next. Just go ahead, read through that. Okay, so for our agenda today, we want to go ahead. We've already done 1 and 2. We're going to talk about the hypertension bundle and review, overview of the hemorrhage data. Sergio and Mary from ADHS are going to go over the Arizona State Health Assessment. We're going to go through our AZHHA updates, and then James from DeNova is going to go over some mental health resources. We'll go over some education and resources. And I'll hand it over to Megan.
All right. Can everyone hear me? Good. Okay, awesome. All right, so we have the hypertension bundle in review now that we have all of 2024 in. So thank you very much for finishing that up. We're excited to where we've been and happy to retire so we can focus on the 2 new bundles. All right, so this is just kind of an overview of the whole entire time. So way back in the day, we started data collection on the hypertension bundle in Q3, April to be exact, of 2021. So that's our baseline there on the far left. And then over time, as you can see in the purple line, which is the patient treated within 60 minutes, we just got better and better and better. And we were able to sustain over that 80%, which is our treatment goal, for 1 whole year. And I know we'll continue on. So that's fabulous and great job. The yellow line is our debrief goal. You can see that we were really low at the beginning and we came up quite quickly, and we're able to not only sustain for more than a year, but to be above, well above that 50%. And we did dip down at the last of Q4, but we know that we're going to come right back up because we've been able to sustain for so long. Just breaking that up, showing that we're finally ended on 83% with a goal of 80 for time to treatment after sustained treatment of over 80% for a year. And then the debrief rates, we got all the way up to 72, and the goal is only 50%. So that's fabulous. I know we'll stay up there. You know, we've had our little pitfalls over time. So we landed at 47 for the end of the year, but that's only 3% to the 50, and we'll get back up. And then I'll hand it off to Jen to talk about the hemorrhage bundle review. Great job, everybody.
Very good job. Our hemorrhage, we continue to do very well as well. Our facilities with OB hemorrhage cards readily available, we're at 96%. We want a goal of 100%, but we're getting there. Blood loss measure at 65%. I believe those numbers, as we have some other institutions that are instituting some of our measured blood loss, our numbers are going to continue to go up this year, which I'm very excited about. Facilities with the hemorrhage risk assessment 77% complete. We still have some work to do in this area just to make sure that our facilities are continuing to do the risk assessment, but we'll get there. And then again, kind of with the debrief for the cases with greater than 1,000 mLs of blood loss, for whatever reason, this last little quarter, we've had some decrease in the debriefs as well, both for hypertension and blood loss. So just a reminder to, talk about the events that these happen, debrief with the team so we can, figure out ways to improve this in the future.
Have any questions on data before we move on? I'm watching the chat, so you can throw them in there or come off mute. All right, well, hearing nothing, you can always put it in the chat and we'll keep monitoring. Go ahead.
All right, so we're going to go ahead and introduce Sergio Perez, the Strategic Initiative Lead for ADHS, and Mary Glidden, the Fatality Review Office Chief for ADHS. They're going to go over the Arizona State Health Assessment. So let's welcome them to go over our Arizona State Health Assessment.
Hello, good morning, everybody.
Morning.
Is it possible I can share my screen? No,
You should have the ability to.
Yeah.
I see it now. Yes, I apologize, guys.
You're good.
Technology, not the forte, but thank you, AZHHA and Megan, for inviting us to share a little bit about the state health assessment. I'm gonna, in the interest of time and knowing that I have Mary here with us to support, and knowing that she's got a lot to offer this group in particular, as she's someone who works in our maternal health area, I want to make sure that I give you guys enough time to connect with her and that she can answer any questions that are specific to maternal health. So I'm going to kind of breeze through the document. So just a little bit of a disclaimer there. I do want to, let me just see here. Got two screens going, so okay, cool. So just, this is a little outline. I'm gonna, again, breeze through the all the sections really through this. So again, we're gonna do some acknowledgements, overview, let us know a little bit more about what the methodology was in terms of getting the data, and then some of the features that are part of the health assessment, which are the Arizona profile, the community conversations, and then also we have our traditional pieces of the health issues sections, and then also the factors contributing to health. And then we'll let Mary talk about her programs that are part of maternal mortality review. So acknowledgements, again, this is the state health assessment, and what we really want to let you all know is that this is a document that is for the community and by the community. So we really want this to be a meaningful resource for you all who are in the community doing the work. To that end, we do want to mention that this presentation does have some sensitive topics, as we do talk about data that elucidates the picture of what Arizona is looking like in terms of health in this current time. Also to that end, we also want to acknowledge that data is not always fully representative of the picture. It is not ever going to really fully elucidate those complexities that health and wellness across all populations and situations. So just know that, again, your insights are always important as well, and human voice is also important as well. So data is important, but also should be taken with a little bit of a grain of salt. So what is the state health assessment? The state health assessment is a comprehensive snapshot of data in terms of what our health looks like in Arizona. Why we do it is this is kind of the catalyst for our program policy planning and resource allocation. So essentially what is known as our state health assessment leads into our state health improvement plan. And so some of you have been in part of the health improvement plan and know that what we do there is we have goals, our priority areas, goals, strategies, and tactics, and partners, stakeholders that are working together to really talk about what those efforts look like and really create a 5-year plan based off of the state health assessment. So the state health assessment is really built with 3 major components. One is being primary data, the second is secondary data, and the third is our subject matter experts. That's really where we get folks like Mary to share their insights, and we encompass that, encapsulate that in our state health assessment, which is why the document is a robust 300 plus pages. Also of note is that this data is our best practice was to try to use 10 years of data for the trends. So for the most part, when you see a trend, it will have 2013 through 2022 data sets. So that's something for your reference. Also, it's important to know that public health data has some limitations that are important to note that make it difficult and hard to fully understand what health issues are and how they look. So sometimes the data collected isn't, fully detailed enough, or doesn't include the people that it should, like the certain people from certain age groups or certain communities. Also important to note is that, 1 second here, it's important to note is that my notes here are hiding behind my picture. The information focuses on things like how many people get sick or die from a disease, but not other important factors of information like how the disease affects people in their daily lives. So collecting more types of information, such as people's experiences and social conditions, those help us to create a more defined picture for that snapshot. So what does our Arizona profile look like? Jumping right in, we are still one of the fastest growing states in the nation. You can see our population is steady on the increase in the past 10 years, that despite our number of births slowly decreasing. What that means is that if we were to look at the age groups in a chart kind of by themselves, by age group, you'll see that our age group of 1 to 14-year-olds are the age group that have a decrease in, and then the age group of older adults are the ones that are increasing. Half of our state identifies as a racial or ethnic minority. The state's life expectancy is 75 years, but if we were to break it up in terms of geographic or regional areas, you'll see that there's a great difference between 70 and 80 years. And then also, if we were to break it up between racial or ethnic identity, it would go from 77 to 59 years. So there are some great disparities there. Our two leading causes of death are still cancer and heart disease. Also of note are unintentional injury and COVID down here at the bottom, which is our new friend, has made it to the chart. So in terms of unintentional injuries, the reason why that's important is because that's causing what we have here, are demonstrating here, which are those years of potential life loss. So despite having more instances and occurrences of heart disease and cancer causing mortality, the fact that the younger folks are actually having to have higher incidences of unintentional injury is really driving up this premature mortality. So what that actually looks like is that if you see the leading causes of death by age group, you'll see that the 1 through 44-year-olds unintentional injury is the #1 cause of death there for those age groups. So what does that mean in short? In summary, is that our population is still increasing despite the low birth rates. As of 2013, our increase in the older adults is of note. In 2022, almost half of our population identified as a racial or ethnic minority. Our life expectancy at 75 years. However, we would break that up according to geographic location or racial or ethnic identity. That does shift quite dramatically. And then, of course, our cancer and heart disease are still our two leading causes of death, with a note that unintentional injuries are the place where we could have that cause the most premature mortality. So community conversations, this is again trying to increase the picture, the definition of the picture that we want to give folks. To that end, we met with 10 different impacted groups. We had 22 different listening sessions across the state, and we asked them essentially 3 questions. What does health mean to you? What do you see as the assets and strengths and challenges to your community? But then also what you would like to see prioritized in terms of public health efforts from in your community. So what that actually looks like for a lot of these folks is we actually did a graphical interfacing facilitation. So you can see these questions are actually answered in some of these shaded areas. So like, what is health? the challenges, and then the assets and future thinking there. So the reason why we did this is, again, increasing the voice of community members. With such a data-rich document, it's important to note that these are human lives that we're speaking to, and that their voice is also important as well. So we might have game plan, and we have a lot of professionals that are in the room today and that we're constantly speaking to, but it's also important to note that the patients, as it were, or the folks in the community are also important to hear what they would like to note are those things that what creates health, what they would like to see prioritized. So there are some overarching themes that I don't want to get into them too much because I want to give Mary some time. So I want to jump right into the health issues. So our infant mortality rate is above the national average. We're at about 6.2, where the national average is more about 5.6. If we were to break this up in terms of racial or ethnic identities, we'll see that African Americans and Native children are the ones that are mostly affected. You can see our African American population is closer to 12 and closer to 10 for our Native population, whereas some of our other communities are hovering around a 4, 5, and 6. So those are some of the opportunities there in our communities. Also of note is that maternal mortality in Arizona has been decreasing, although we are still well above the national average there. When it comes to pregnancy-associated deaths, we have these 3 different data sets, and as you can see, even on all 3 years here, some groups fare way better, and there are some solid opportunities here to do some great work. If you can see, our Native population, African American population, has sometimes an instance of double or even triple what some of our other community members are dealing with in terms of pregnancy-associated deaths. Childhood vaccination rates. This is something of note. Just as we have again 10 years of data, we are seeing an increase of almost double of the folks asking for those non-medical exemptions. So that's of note for anyone who has children. STIs, these are also on an increase. So if you can see, our 2014 data has it at 91 transmissions, and we currently have about, or as of 2022, 1,091 or 92. So there are some special work groups that are working on this, and I'm sure you all may be aware. If not, then I know that Mary is definitely very aware of what some of those work groups look like. Again, speaking to the STI information, is that in 2022, the second highest rate of congenital syphilis in the country, and we had 33 babies pass, unfortunately. So our number of cases is something close to like 255 or 257 rather. And again, those number of mortality, this is on an increase right here. So this is, again, important to note because there's some possibilities or opportunities to do some good work. So kind of getting into our section here, our rounding, I guess, third here as for a baseball metaphor for any of those spring training fans out there. This is, again, one of the sections that we have traditionally put in our document that is really where you can find a lot of these expertise from our subject matter experts on a lot of the issues. So if you're looking to get more insights or learn more about any of the things going on in the community, I would definitely recommend looking into this section. Again, this is where we share a lot of our insights from our subject matter experts in our agency. Of note is I will kind of highlight just one section here, the healthcare access, only because if you may have noticed from some of these previous, actually I took away a lot of the slides, so you guys would not have noticed that some of our data did come with maps of where some of these instances or occurrences are happening. And what you would have noticed with our healthcare access map is that it looks, a lot of our health issues mimic or mirror even a lot of times what the access to healthcare map looks like. So if you're familiar with our HIPSAs and our dental and primary care and mental health HIPSAs, they really highlight where the opportunities are to do a lot of public health work in the state. So again, in the interest of time, I cut this short because I wanted to make sure that we got to Mary quicker. But so again, we're trying to just getting to home plate here. The major thing that I like to highlight is the state health assessment is really the catalyst for us to try to engage with community for the state health improvement plan. And the state health improvement plan is one big vehicle that we use to help encourage and stakeholder engagement with our partners in the community. And to that end, we also have another robust tool that has just come online in these past few months. So if you, in case you have not noticed or have not visited our site in a few months, we definitely encourage you to visit the public health data portal. It is for any and everyone in the public health world, from novices. If you're fresh onto the scene, if you're still in school, you can learn a lot from our dashboards. If you are a researcher, you know, there's a lot of connections that can be made by requesting data sets. And, you know, you may have folks that are already in the building that you're connected to, but if you're not, you can definitely establish connections that way as well. And again, for folks who are out there doing the good work like yourselves, there's lots of great reports and catalogs and things of that sort that may help you in your everyday work. That said, I want to now pass it up to Mary, as she is one of the office chiefs for our maternal health efforts, and I'll leave her to do her intro because I apologize. I totally do not have your title right in front of me. And I know that you do expansive work, and I actually have seen you over the years grow and do different things in that same realm. So I don't want to misspeak.
Sure. Thank you so much, Sergio. I appreciate it. Yeah, I'll talk a little bit about fatality review in general, but try and focus on maternal mortality as it relates. But my office is the Office of Fatality Review at the Department of Health Services. And the purpose of fatality review programs is to have a multidisciplinary committee to review essentially all deaths in Arizona in order to determine causes of death, factors that contributed to the death, and then kind of most importantly, like specific and feasible actions that could have prevented the death. And these are our like prevention recommendations. So whenever we publish a report, they always have those prevention recommendations that go out to partners and agencies to help implement those changes. There are 4 fatality review programs at ADHS. We have child fatality review, overdose fatality review, suicide mortality, and then maternal mortality, which you can see here. Some are newer programs, so we are still developing websites for all of them because they all have really important information to share. But the maternal mortality one is kind of shown here, and then I believe the link was provided. Thank you. And this website has the most recent report, the maternal mortality that Sergio shared, the 2018 to 2019. That was published in January of last year. And we'll actually be publishing a new, specifically a pregnancy-related report for up to 2020 deaths. So when that's published, we'll share it on the website and share a blog out. And then I can come back and share the most recent data for maternal mortality with all y'all here. And then this website also shares where we get our data sources, which is like a little bit different than like where Vital Records gets their maternal mortality data, just slightly, because we use hospital discharge data as well as Vital Records and death certificates. And then where we kind of differ is when we dive into those fatality reviews and kind of talk about whether this death was pregnancy related or just like associated with pregnancy, as in she was pregnant within the last 365 days, and this death happened to occur during that time. Yes, shares data sources, and then how far we are in our current review. So currently we're reviewing 2022 deaths, and we are about 20% into those deaths. And then it also has all of the reports we published, and recommendations that we have published. So if I can go to the next slide and then click, okay. Will you click one more time? I just want to share an example of the prevention recommendation. Perfect. Okay. So our recommendations for fatality reviews are typically broken down kind of like this. We try to do like who is going to implement what, when, and where. since mental health conditions was a leading underlying cause of death for pregnancy-related and pregnancy-associated deaths, this is one recommendation that came out of the report. So increase access to high-quality mental and behavioral health services and resources that are affordable, trauma-informed, and supportive of the family unit. And then we talk about delivering high quality mental and behavioral health resources should look like evidence-based standardized processes for referral, intake, and care and coordination across all settings, including but not limited to, of course, inpatient care, standard and intensive outpatient care, maternal and youth-specific care, tribal health clinics, long-term group homes, and clinics offering MOUD services. And these services should also involve coordination of resources through social work, case management, and peer support services. And I know that's like a wordy recommendation, but then within those recommendations, if you would click for me, we have strategies of how to do this. So what does improving accessibility look like? It looks like integrating mental and behavioral health services into perinatal care. It looks like improving referral processes. It looks like timely delivering of services. What does access to affordability look like? It looks like expanding insurance coverage for comprehensive care. And then what does trauma-informed and supportive of the family unit look like? It's establishing residential treatment that allows children to stay with families. It's providing options for childcare during appointments. So that's kind of how we build our recommendations and provide strategies for implementation to kind of support moving these recommendations forward. So we want to get this data and especially the committee identified recommendations out to partners and agencies. So if you have a lunch and learn or a group that would want the most recent report and recommendations presented, please don't hesitate to reach out to me. Like I said, I oversee that Office of Fatality Review. So I have I can share that information with the program manager to share that information with you guys. So thank you for your time. I appreciate it.
Thank you, Mary, for bringing your knowledge to the group here and making yourself available. To that end, I want to go ahead and continue. We have a few more slides here. I just want to wrap up the full-on discussion here and give you guys some more links. I'm going to put in the chat here before I start talking and lose my place, some links to the state health assessment, but also a link to our state health assessment feedback form. So as I mentioned, the state health assessment is the catalyst for the health improvement plan, the state health improvement plan. And what was a critical part of getting a better snapshot of our health were those community conversations. And to that end, what's going to be a critical part of our health improvement plan is using the voice of our stakeholders as well. So that's where you all come in, and that's where that second link for the Google form or the feedback, why that exists is that we would like to include your voice as part of that vision of what to prioritize and how to go about the next 5 years of the health improvement plan for the state here. So to that end, we kind of just have it really open-ended. There's just 3 questions and kind of on the same pulse of what our community conversations were, which is to improve health for Arizonans, what do you believe should be prioritized? What do you consider to be the biggest unmet needs are in Arizona? And what are the top assets for improving health outcomes in Arizona? So we're looking forward to hearing your feedback and to continuing on forward with the again, the discussion of the health assessment, but also more importantly, for me, it would be the state health improvement plan, as that's the program that I support. So Megan, I want to say thank you. This is really the end for me. Mary, again, thank you for supporting our partners here and making yourself available to them. If there's any questions, we can take those now for sure.
Thank you both so much for being here. We have some things in the chat. I don't see any questions, however, but I'm sure everybody's got to kind of process it. And thank you for asking for feedback. You know, we all have a lot of feedback to give on maternal health, and we're happy to help move the state forward. And if you come up with a question, anybody out there, and you want to put it in, and even if they've popped off or if that's the end, we'll record the conversation and make sure to get those questions over to Sergio and Mary. Okay, seeing no questions, I'm just going to repopulate. Thank you both so much again. Alrighty. So a lot has happened in the world since January when we were all together. And I just wanted to walk through some of the updates of the next steps that Crystal had shared in January, just to kind of tell you where we're at so that you're not wondering with all of the things going on in the government currently. So number one, we were successful in retiring the hypertension bundle. All the data was submitted. Thank you all very much through December of 2024. So that's all been aggregated. We've got that report. We're going to give it to National AIM and show them how amazing we are. So thank you all for that. Of course, the dashboard and the survey remains open. So if you are a facility that feels like you have a little bit of extra work to do, please go ahead and continue to use the survey and the dashboards. You can still see your data in real time and see where you're at. So please go ahead and continue that. We were planning to start collecting the mental health and the substance use data starting next month for all of March data. With everything going on and some of the shutdowns have pushed back that collection, unfortunately. So we need the new surveys to be built in that Qualtrics system with the dashboards. And the funding for that has been pushed back, unfortunately. So we're not looking at that until May or June. We're hoping for May. So that more to come on that. We just need the platform. If you wanted to start working on those few measures that we already talked about in January and start collecting your own data, there's just no platform to put it in at this point. And again, we're really, really hoping that we can do it in May. Everything hopefully is on track now and getting back started so we can get that done. The metrics you can see there, the 4 metrics that we decided we're going to start with: provider and nursing education on mental health within the last 2 years, the written assessment and response protocol for mental health conditions is tiered based on illness, severity, risk of harm. If you don't have one, AIM has plenty, please let us know. Substance use disorder metrics will be the provider and nurse education on substance use, and then provider and nurse education on respectful and equitable care is the same as previous. So if you've already had that done in the last 2 years for the other bundles, then you'll meet that for this one. Hoping again to get those in May or June. We're going to continue collecting and submitting data for the hemorrhage bundle because that's already built and running. So please really focus on that and see if we can get our numbers as high as possible before we dive into these other metrics. And then unfortunately, we're unable to have an AIM conference in 2025. Just means we're going to save all of our money and we're going to build it bigger and better in 2026. We'll make it the best there is.
Megan, just really fast, just to interject, there's a question
Sure.
in the comment. Just to let you guys know, for the mental health and substance use disorder protocols and different metrics, all of the stuff we have on our website for resources, and then it's also available on the National AIM website, like Megan had mentioned. So we have all of that there for you, and I'll share the link for our website with all of our resources for you guys to kind of start combing through and seeing what would help you to start educating your nurses and stuff.
Thank you, Jennifer. Oh, that was on the next slide. Look at that. So we'll put the link in the chat so you can get to it. We also have bundle implementation toolkits, which are essentially PowerPoints that you can use pieces of educating new staff or sharing it with staff on those 2 bundles. So those are in the works and they're hopefully to be posted to this site with all the other bundle resources and the AIM national resources in the next month. We're just doing some cleanup on the actual PowerPoint itself, and then we'll get those posted and we'll let you know when those are posted. And APAL is amazing and we all love them. They are continuing to work on the educational offerings that we had promised. regardless of funding. So I absolutely love them. They are going to be doing 3 series for nursing and 3 for physician on SED, mental health, maternal mental health, and equitable care. So those will meet all of the education metrics that we just mentioned. They're also going to be able to offer CE. It's going to be through a learning management platform through the University of Arizona. These will be on demand. You can watch them whenever you would like. You can watch all 3 in the series, or you can watch each one. You will get a certificate for each one that you watch, depending on what you need. And that launch, because they're currently working on them now and recording webinars, is expected to be in May, June as well. So right when we get those dashboards and survey platform up to collect data, we'll also have all of those webinars available through APAL and the U of A. So very thankful for them. And then for the neonatal abstinence syndrome resources that we really wanted to do, it's still on the docket. We really want to do it. It's just on hold as we try to catch up with all of this other delay on these other things that we had promised earlier. So we are still planning on that and hoping to add that as a resource in the future. We're going to focus on the 2 bundles in the meantime, really get those up and running the way that we had anticipated, and hope for no other delays. And that is where we are with all of our next steps.
Just to let everybody know, I put in the AIM Collaborative bundle information there. And then I also put in a link to APAL, which is a great resource for providers to guide treatment for patients with mental health issues in relation to admissions to the hospital, and then substance use also. So they're a 24-hour access line for physicians to call to directly be in contact with psychiatrists. So just so that you guys have that, so that you can really use that resource.
Thank you so much. Do we have any other questions on kind of where we're at, where we're going, where we hope to go? I'm just a little delayed and behind.
And if you guys
Okay.
do need any help too, Megan and I are here. We can help you virtually, you know, things like that. So reach out if you do need help.
Absolutely. Good call out. And then one of the other things that is part of the AIM bundle that we will be working on in the future is resource mapping, so that you have a map of easily to access resources for your patients when they do potentially test positive, screen positive, and may need some extra support. So in light of that, we wanted to introduce you to one of our wonderful mental health resources in Arizona. They're growing. So this is James Longo, the Director of Business Development for DeNova. If you don't have a DeNova in your community, you might have one soon. They are reaching into the rural areas, which is wonderful because they offer postpartum psychiatry and addiction medicine. So that is huge. We don't have that a lot, especially in the rural areas of Arizona. So we wanted to have James come on and let you know what they offer your patients.
Yeah, thank you so much. Can you guys hear me okay?
Yep.
Perfect. Awesome. Well, I'm going to share my screen really quick as well, and then I'll get through this for the sake of time. So thank you all for your time here. Again, my name is James with DeNova Collaborative Health. We are based here in Phoenix, Arizona, but we have other locations that I will show you guys here in just a little bit as well. So currently right now we have over 250 licensed therapists and 45 psych providers, 25 case managers. These are all Arizona based. All of them are W-2 employees through us. That's not a contractor base or anything like that. So all of our therapists and providers have been vetted by our corporate teams to make sure that they're good. But we offer primary care, therapy, psychiatric services, case management, med management, and primary care. All of these can be done virtual or in person. And so that really does help with the rural areas, and we are expanding to some more rural areas as well. Right now for primary care and for psych, we can usually get patients in within about 24 hours. We just try to say 72 hours just to be safe. But with the ability to have so many therapists and providers that we have on staff, we can get people in as quick as possible, which I know is always something that's a struggle when people are trying to get help. Just some of the reviews that we've had last year. So we had over 20,000 reviews come in. We averaged 4.8 out of 5 stars for patient satisfaction. How we get these is after each time a patient has a service, or when they complete their services with us, they fill out a survey at the very end to let us know how they're feeling and all of that. So if you see on this screen is after each patient visit, they are sent a de novo system-based assessment to check in on how they're feeling, how they're doing. This just gives you a breakdown of those outcomes of having a 38% reduction in general depressive symptoms, 29% reduction in severe depression symptoms, and 40% reduction in general anxiety symptoms. So this is just over a few months. It usually gets better even as the longer that they stay and work with us. Super easy information that we need: name, date of birth, contact number, email address. This is important just for consent forms. They're all sent over there. If they're on any sort of medications, we like to know that as well ahead of time if possible. And then translation services. So we have about 25 providers that are bilingual. We also third party with another organization that can come on if we need a language that we don't have. How to contact us or to get a patient sent over to us. Again, super simple. We have a fax number, or you can just email it, referrals@denova.com. The nice thing is then we actually go out and outreach the patient, so you don't have to be the middleman trying to help get everything scheduled. We will outreach the patient 3 different times, 3 different days on 3 different times within those days. So usually like a 9 a.m., a 12, and a 3 p.m. on 3 different days. If for any reason why we cannot get in contact with the patient, we will let you know of that as well. So just a heads up on that. I am not going to list every insurance that we have because it's a lot, but we take every access plan right now other than the REBA plan and the Indian Health Plan. We are in contract phase right now with the Indian Health Plan, so I would assume we'd have that by like June. So that'll be coming up soon. We take every commercial insurance other than Humana. We do have a cash pay option, and we do offer a sliding scale option for people as well. Some of the other services that I didn't list, we have the postpartum psychiatry, addiction medicine, autism evals, child psychiatry, nutritional support, LGBTQ psychiatry. And then what we've done at some places as well that are in really rural areas, like in Yuma and Kingman and places like that, where we're not fully established yet, we actually have set up like a virtual room at a clinic or at an office where locals can come and at least get on virtually with one of our providers if they don't have the ability to have internet or a phone or anything like that. So the only population that we do not currently see are those that have been deemed SMI. We're working on potentially getting a couple providers that can do that, but those are the only patient demographic that we don't currently see. And like Megan was saying, we do have the perinatal mental health here. So we have workshops, health plans, support services, psychiatry, medication. And this is something that we're really passionate about. So if anybody has any questions, please feel free to reach out, contact me directly. Here's our locations right now. We have 6 locations in the Valley. We did just open our Tucson location about 2 months ago. Flagstaff should be July or August. Yuma should be probably just a little bit after that. We're under construction in Yuma right now. And then Peoria should be later in 2025 as well. So a lot of different options for patients to pick from. Again, we do offer opportunities to be virtual or in person. Here are some of our marketing that you'll see around the Valley. So just a heads up on that. We really tried to help people to understand that they can get the help now and they don't have to wait and try to hold back anything that they're struggling from, which is why you see the help can't wait, addiction can't wait. But you'll see a lot more of these. We also are releasing some soon that are a little bit brighter and not as dark as these ones as well. So just a heads up on those. Here's my contact info. I'll also put it in the chat for you guys as well. Call, text, email, whatever's easiest for you guys to answer any questions I possibly can. So not sure if there's any questions anybody has. I know I went through that fast, but I know I was on limited time, so I wanted to get through it.
We do have a question in the chat. Can we get that perinatal flyer, or do you have a link on your website for that perinatal flyer?
I can send it to you.
Yeah, that would be awesome. Then I can send it out to everyone.
Okay, perfect. Yeah, I do not believe we have it as a flyer online, so I can email it to you.
That would be awesome. That is our bread and butter. That's what we want. And we're happy you
Perfect.
have it.
Absolutely. Absolutely. Thank you so much.
Awesome. Anything else from anyone? Any questions? I'm glad you all are expanding into the rural areas. We all know we need it. And Tucson, yay. There's another. I agree. Tucson, yay.
Perfect. Yeah, if anybody in Tucson wants to come and see our clinic as well, I can meet you there. I usually go down once a week, mainly on Tuesdays. So if anybody wants to see our location there, I'm happy to set that up as well.
Awesome. Brooke says we would love that, and we'll send an email.
Perfect.
Wonderful. Well, thank you so very much for coming on and sharing with us. We love any resources we can get for our patients because we all know that there's not enough. So we really appreciate you being here.
Absolutely. Thank you all so much.
Alrighty, so on to some education and resources for you all. Okay, so we have the Substance Use Disorder Resource Hub, which is a wonderful, wonderful resource for Mama's Voices. There's all kinds of things on there, including real patient and family experiences to help kind of guide navigating substance use. So wonderful resource hub from them. A1 has an Ask the Expert using A1 to guide clinical practice in electronic fetal monitoring. That's coming up on March 26th, which is tomorrow, but it's free. They also have a practice alert for the management of amniotic fluid embolism. So that is, we'll send these slides out after so that you can have access to all of these links for all of these resources. Okay, it's frozen. Hold on one second. Okay, and then we have some free video resources on SUD. So those are great, from Brazelton to their little short videos if you wanted to play them in staff meetings, get the conversation started. The A1 conference, the convention, it's going to be in Orlando, Florida in June. So a wonderful time to be in Florida is June. Earn up to 77.5 nursing contact hours. So that registration is open now. We also have some virtual AIM trainings from the National AIM Group. They have AIM Sustainability, Community of Learning, talking about engaging stakeholders and sustainability success. They also have a TAP, which is a technical assistance webinar on hypertension and blood pressure cuffs kits, if you can get those for your patients. The Hear Her campaign always has some great resources for patients if you need them. The Policy Center for Maternal Mental Health has some slides and videos on substance use. And then there was a new article that just came out recently that links postnatal depression to disrupted oxytocin system during breastfeeding. So that's a quite interesting read. We have the 2024 Maternal Mortality and Morbidity Prevention Report that just came out, and that was through Relias. We also have an infographic for the high-risk areas of maternal mortality from the same group. Very interesting. And then some more education and some articles. Our next call is going to be in May, and I'm really hoping that we're going to be talking about how to get on to the new data platform or the new survey. We're going to be talking about all of our APAL trainings. It should be right around the corner, and we'll be well on our way to really getting this substance use disorder and maternal mental health bundles off the ground. And Jennifer, do you have anything else before we sign off?
No, I